system, for the majority of people, fever is the hallmark of infections. Only old folks who have lower immunity, they may not have a fever. They may just be tired and fitting other symptoms. But for us with an intact, active immune system, if you have a fever, there's an infection going on. Number 2, talking about fever as the hallmark of infection, I want you to be able to measure your own temperature. If you don't have a thermometer at home at this particular time to measure your temperature accurately, please go get one. Because the idea is we're going to have you take your temperature, and that's how we're going to use it to monitor. Okay? So here's the thing. Let me get you the easier way out. It's not the end of, obviously, this is not the end of the show. Suppose you don't have a fever and you have not had any serious exposure to the virus or travel history. Then your cough and your runny nose, right? Could be something else, mild, a cold. Could be allergies. I mean allergies, because usually you don't run a temperature with the allergies. So your risk really to have that COVID-19 is low. So don't panic, stay home, relax, protect yourself, do the usual thing you have when you have a cold, your allergies, you take a lot of fluid, you get some rest. You can take some over-the-counter fever medications, pain medications, okay? And then it will pass, you'll get better. On the other hand, if you have a temperature of 100.4 and above, with your cough and runny nose, and now you have sore throat, you have body aches, you have fatigue. Some people usually tell me even their hair hurts. And there's the flu going on in your area. You may have the flu, or some of the thousands of viral illness that circulating during the winter time. So the second question now become very important, because now we increase the level of the symptoms. Now, tell me, where have you been? Where have you been exposed yourself? Have you traveled in any community where the virus is spreading? Okay? So, are you really at any risk of exposure? Now, just in case you don't know about the exposure risk, there's plenty of information. As a matter of fact, if you go to www.cdc.gov, you'll find out all the information. They have them outlined for you. According to the CDC, the people at the most risk of acquiring the virus are, number one, people who actually travel in community where the virus is spreading. Okay, you are at elevated risk if you've been to Italy, China, obviously, South Korea, some of the level 3 region where you shouldn't go through, you are at risk. If you have close contact to anybody who have the virus, COVID-19 virus, you're obviously at risk, and this is very important. Those people, you may not even need to be sick, you will need to be looked at. If you live in a community, for instance, where there's an ongoing spread of the virus in that community that caused the COVID-19, then you are at elevated risk. For instance, in New York, just last week, the beginning of the week, they had one case. Okay, by this week, especially in the area of New Rochelle, New York, Westchester County, they're already over 100 cases. And it turned out the virus is spreading in that community. And when they actually did the epidemiology, the sources, all the people who actually gotten sick are linked to one person. And they were at a wedding. There were 400 people in that wedding. Unfortunately, we're not testing as many people as we need to. That's why it's trickle. Okay, we'll talk about testing in a minute. So now here you are with the temperature, my friend. All right, you got a temperature, and you're in a community where the flu, and you cough, you have body aches, but you haven't traveled anywhere, you haven't been exposed. So, Jeffrey, what do you think you have? What do you think is going on in your mind? Do you have COVID? Do you know? So yeah. So do you? I'm talking to my assistant here just in case. This is Jeffrey. So you have the fever, you have cough, you have body aches. All right. and there's flu in the community, but you haven't been exposed, you haven't traveled anywhere in this community, there's been no active spreading of this virus. So what do you think? Okay, that's a very good answer because we don't know. Okay, it could be the flu. Okay, now if you really want to know exactly whether you have the flu, you can get tested easily. You can go get your flu, a flu test, and then it will tell you. Or if you want to take chance, you stay home, don't circulate with anybody, and do those public health preventive measures. Wash your hands and isolate yourself. Don't go to crowd. Wear a mask and all this stuff. So it could be that, but it also could be another virus, okay? Now, what I want you to know is, if you really want to kind of drill down further on the symptoms of the coronavirus, then there's a little bit of difference, because characteristically, the symptoms that have been reported for the virus when you're actually sick is that the fever is there from 100.4 and above. You have a cough, okay, but that cough is usually, as far as we know, it's a dry cough. And then the flu may not have that. The other symptom disease may have that. The characteristic symptoms of the coronavirus is the shortness of breath, because this virus want to go to your lung and give you pneumonia and kill you. I mean, that's essentially, okay? So any symptoms you have, and you have any respiratory symptom that involve a lot of shortness of breath, if you don't have asthma, then you have to suspect that. But your point is well taken, my friend, because you got a fever, you got those symptoms, okay? You cannot be sure. Can you rely solely on symptoms? Not really. Not as the way this thing is spreading so fast. So yes, having a testing done is very important. That's how we're gonna know. Okay, that's how we're gonna know. And the majority of people who may carry this virus may not be sick at the beginning, or they may have a mild symptoms. Okay, so it's really, from a public health point of view, to know for sure that you should have a test done. Okay, but until the end, keep in mind, having a fever and the exposure, the traveling, is very, very important, just in case you don't get access to a medical system. And if you unfortunately turn out that you may have the exposure and you have the virus, and you're not really totally sick, but you can actually stay home and start adopting those public health measures for preventions that I will discuss in detail, because those are the things that you actually can do. Okay? So, now I don't want to go to the tests detail, but what I can see at this point is the fact that we've been behind the 8 ball. Because in order to know exactly the quantity, amount of folks who what we call the incidence of this, we need to be testing. Not only those people at risk, but people who actually have symptoms, if they're not sure really what exactly they have.
Right.
But at the same token, if you really having all this stuff, but there's no fever involved, and you haven't had travel history or exposure history, then you're good. Okay? So now let's talk about the virus a little bit, and then just basically focus on the facts, because there's a lot of things been out there. Okay? Now, the difference between this virus, the COVID-19, and the other virus that have caused pre-epidemic, this virus also, the COVID-19 is dangerous. There's no doubt about it. And it's deadly. But the reason it's more dangerous to me, and according to some of the experts I have listened to and talked to, is the fact that it is extremely contagious. Okay? I mean, you just one virus you drop in the community